David Greene with PreferredPainCenter.com, where we bring you anything and everything education for pain management. Today I'm out at the Carefree Recreational Park, which is a gorgeous area that has a lot of hiking paths, picnic areas, and even on a day like this where it's 70 degrees and gorgeous, it's really not that crowded. So a lot of open space. The topic today is your pain in the low back coming from your low back? And it's a little bit repetitive, but basically studies have shown that 25% of patients who are having low back pain are not having that pain coming from the low back. Something else in the body is causing pain that's being referred to the low back, okay? So just because you have low back pain, 1 out of 4 patients are going to have a problem somewhere else that's causing it, okay? Now, what about that 75% that actually do have a low back problem? You know, usually the most common culprit is arthritis, and there's those, thumbnail-sized facet joints at each side in the back of the spine at every level that can have arthritis just like the hip or the knee. They have cartilage, they see movement. So that's the number one cause. In younger patients, oftentimes the cause might be degenerative disc disease. The disc is 80% water, and as we age, you start to lose a little bit of that water, and some people lose a lot more than others. There might be a genetic factor involved. They might be like a truck driver, see a lot of trauma to the area, and they may end up getting low back pain due to tears in those discs that spark up pain, okay? Let's talk about that 25%. Where's the pain coming from? Well, one of the biggest culprits of low back pain not coming from the low back is the sacroiliac joints. The sacroiliac joints, there's a left side and a right side, and they're below the low back in the buttock area where the pelvis on each side meets up with the sacrum. And that's the sacroiliac joint, sacroiliac joint. It's a long, irregular looking joint, can be a little jagged when it gets arthritic, and that can refer pain into the low back. Very common, okay? I mean, probably 12 to 20% of all low back pain comes from the sacroiliac joints. It's very impressive. So, how does that diagnosed? Well, there's some physical examination techniques that can be used to see whether the SI joint is the problem. Also, imaging studies are not very helpful. Arthritis that's in the SI joint, you may or may not have pain from that. So if the physical exam is and maybe it's some tenderness to palpation over the area, if the pain doctor does a diagnostic injection of numbing medicine around the SI joint and into the SI joint, and it relieves the pain a lot, most likely that's the reason that person was having pain. The other reason that patients may have low back pain not coming from the low back is a hip problem. Now, you might say, well, the hip's not even in the low back. How can that cause an issue? Well, if you have arthritis in your hip or a tear in the cartilage there called the labrum, then it may lead to significant hip pain, but it's going to alter possibly the way that you walk. It might make you limp or have a noticeable hitch, something to try and take pain and stress off of the area. So that can cause low back pain as a compensatory maneuver, okay? Now, you may also have a problem somewhere else in the lower extremity. Like even a foot problem can cause you to walk a little bit off kilter and have low back pain. There's some folks who have posterior tibial tendon dysfunction. They may have arthritis in the ankle or the knee. It can cause you to walk off kilter, like I just said, and have pain in the low back not coming from the low back. So what's the answer? The answer is to be seen by a specific pain doctor who has the training and the expertise to help diagnose where exactly the pain is coming from. Now, interestingly enough, a study has shown recently that in 10% of patients, nobody can figure out where the pain is coming from, okay? So it's not a foolproof idea that you're going to get the exact pain generator known with a full workup, all right? Arizona Pain Specialists has varied locations around the valley. They are board certified, award-winning, fellowship trained, and they are the cream of the crop in Phoenix, Scottsdale, and all the surrounding areas. They take most major insurances in-network, so there's no out-of-network issues there. They also take Medicare, some of the Medicaid plans, access, as well as personal injury and workers' compensation. They have multiple different treatment types, such as medication management, chiropractic, physical rehab, interventional pain procedures. Like, for instance, we talked about the hip joint, the SI joint. They have fluoroscopy or ultrasound guidance to accurately put those injections into play. I'm Dr. David Greene with PreferredPainCenter.com. Pain stops here.